I probably don't have enough fingers and toes to be able to count all the healthcare professionals.
How many have we seen? Like 20, 25?
It's probably about 12 to 15 different healthcare professionals.
So we were pushing 20 when we got to some sort of a diagnosis.
We were seeing a physical therapist,
A pediatric neurologist,
MRI at one point,
Electrophysicist,
multiple orthotic specialists,
a pediatric pulmonologist,
paediatricians, then you've got neurology,
pediatric ICU consultant, and all of the pediatric ICU team that came with it.
pediatric cardiologist, optometrist.
Then we started with a geneticist and a neurologist.
re-explaining everything to every healthcare professional,
A developmental specialist, a mitochondrial disease specialist,
speech and language,
GP, hand surgeon,
Physical therapy, occupational therapy, speech therapy, a dietitian and nutritionist,
a second neurologist, a sleep specialist.
moving into let's talk to a geneticist, let's talk to a neurologist, let's start there.
to get the clinical diagnosis that's official. You can then start going to the official sources for your information. But until then, you just kind of scattergun all over the place.
it's just backwards and forwards and backwards and forwards. Yeah, it was challenging.
So, Anne, can you tell me a little bit about the patient registry?
I can tell you lots about the patient registry because it's been a very focused and intensive piece of work that ASUK has funded to enable us to find out much, much more about Alström and begin to pull threads together, hopefully globally with patients, so that this ultra rare disease, that researchers can start to look for patterns and they can start to investigate and interrogate the data, all of which will be anonymous, to work towards, possibly different clinical trials and different treatments and different therapies for Alström syndrome.
Okay. So, as you know, I have a son with Alström syndrome. How do you think that this patient registry is going to benefit my son?
I think for each and every individual, the responses are going to be different, but what we can start to do, if we can get everybody involved in completing it, is we can start to have a kind of overview, a map of some of the symptoms. People are, all different ages. We know some of the common symptoms. We don't necessarily know the uncommon ones, but we can start to get a real global map of Alström syndrome itself. And I know, although that's just thinking from one patient, we don't know how many people there are in the world, and that's just one person. But if one person completes their information and fills in the data about themselves and what meds they take and some of their own symptoms, then we can start to draw some real, start to join the dots together, so we really know what this ultra rare disease looks like.
Okay. So, how would we fill in our information? What do you need from us?
Okay, so what we found helps with those who have already done it, what we've learnt from them, is if you can get all your information together in one place as preparation, and then you can start filling in the information. There's two parts to it. One is a kind of questionnaire, which is quite generic, quite general points, and the other is very specific to Alström syndrome. and that has been written, developed, designed with people with Alström syndrome. And you can do this at separate times. You can come in and out of it. You can save your information so that you don't have to do it all in one go. And you can put your meds in there. You can put your symptoms in there. You can put previous operations in there. So it's a very comprehensive, almost kind of, if you think about it as a giant filing cabinet that keeps all the information secure and safe about you. And for some, you know, for some people that might be a kind of whole family approach or by individual.
Okay. So if you're asking for information about symptoms and medication and things like that, shouldn't it be a doctor that fills in this information?
Ultimately, you know, as you know, Kerry, from your own experience, it is generally the people with Alström syndrome and their families who are the real experts in this. So they live with it. They know about their symptoms. They know about some of the challenges that they have. And certainly it'd be brilliant if they can include all the information that they have from, you know, they're probably sometimes years of going to from clinicians, but it is the person themselves that really becomes the expert in Alström syndrome.
So Alström Syndrome UK have been working really closely with CORDS to make sure everything's in place to make sure that that information is safe and secure. So all of the information that is on there is anonymised. So anybody that accesses that information won't know who that information is about. They won't know names or addresses or anything like that. So you know, the information within that database is safe, and we've looked into that in a lot of details and feel really reassured about that.
Should a researcher want to do more in-depth work with a group of patients or an individual person, then potentially CORDS would contact us and we can contact that individual. Mm-hmm. So that would be quite a personal approach.
Okay. So Anne, why did Alström Syndrome UK decide to go ahead with a patient registry with CORDS from Stanford University?
CORDS are quite specifically doing a vast amount of work with rare disease communities. So although our focus is very much on Alström syndrome, they are trying to map out, you know, hundreds of rare diseases that eventually will try to almost, so you've got this, you know, kind of almost this big map of rare diseases and, you know, the specifics and the things that are unique to each one of those. So it isn't just one rare disease. And CORDS, based at Stanford University in the States, are funded to do this work, to try and begin exploring, finding new treatments, finding new ways to manage, you know, rare diseases, and really trying to get an in-depth look at, you know, what is happening and are there any common threads. So it is, as you know, I said earlier, it is a bit like I kind of think about it as a giant filing cabinet with lots and lots of information on individuals in there, all of which is safe and secure, but that you could pull out and try and make links between some of the, you know, sometimes very unique symptoms to an individual that somebody on the other side of the world might have too, but we have no way of knowing that. So it's really a really deep exploration for us of Alström syndrome. We can start pulling together any other commonalities, including things like, you know, what meds people are using, what meds people have, and how that's changed over, you know, their lifetime, and what, you know, how some people are now being treated with, you know, some different med for the heart, or, you know, just trying to explore all of that. Clinicians would never have the ability to do that, nor would they necessarily have the time. So it's really trying to build that foundation, that kind of very supportive foundation to enable researchers, clinicians, scientists to be able to pool knowledge and learn from it. That's kind of the ultimate aim, is to try and get that gigantic global map of Alström syndrome. So the more people that can complete it, the more we keep taking those small steps forward in our knowledge and understanding of the syndrome. And the next step from that has to be, you know, what other treatments are there that can help, that work?
So in the UK, we've got a highly specialised service and a team of experts helping to manage the care of people with Alström syndrome. What do they think to this patient registry? Do they think it's a good idea?
They all think it's a really good idea, because it is work they want, and it is, you know, they don't have that instant access that they will have. As we said earlier, it's all anonymised, but they, you know, it's also separate, you know, and information is kept separately with your own GP and then with the hospital, and those different hospitals don't always talk to each other, and the notes aren't always in one place. So what we're trying to do ultimately is really, really join the dots for clinicians and researchers to make their lives and their jobs as easy as possible. And that gives us a better chance of being able to not just provide the information, but to kind of, you know, act as a catalyst for clinical trials and things, which, as we know, with an ultra-rare disease, it's always going to be difficult for us to attract those who want to do clinical trials. So the more we can do to make it as simple, as straightforward, as accessible as possible, the more chance we've got of accelerating the treatments and managing the actual syndrome itself.
Okay. And as a family, it's really important to us that if we do give our information and our story and our history to somebody, we get some feedback on that, and that we know that the information we give, we want to know how that's used. Is that something we'll be able to find out from the registry?
Yeah, absolutely. I mean, there's two parts to that question, isn't there? One of which is the sharing of stories is really vital, because everybody learns from each other, you know, what happened at what stage and how did you manage that, and all of that kind of that sharing of your own experiences and being the experts by experience. But the other part of that is all of the information is anonymous. So if a researcher wanted to go a kind of deep dive into certain areas of that, they would have to contact CORDS, and CORDS in turn would need to contact us. We can contact people and ask if they're willing to, you know, share more information. And I expect, I'm quite ambitious about it, but I expect from next year, if we can try and get as many people on that registry as possible, we'll start to have researchers more interested, because they'll have the information readily to hand, with some support of how they can easily contact people. At the moment, it would be nigh on impossible for a researcher to say, well, how many people in the world have we got with Alström? How many of those are suffering from, you know, either hearing loss or sight loss, or, you know, what happened in the first early years? So hence I describe it as this giant filing cabinet, get all the information in one place. So it kind of, not only does it form a legacy, we learn more over the years as we add and add and add to it. And as a family, you are, you know, if you like, when you're supporting your son, or if he's doing it on his own, you're in charge of that information, because you're the one who's updating it every year. It also means you've got a place where you know all the meds that, in your case, your son has been on, and he then knows, and, you know, grandma knows, and, you know, it's also a way of being able to keep a record of all the meds that have ever been used, because you forget what stage, what happened when he was age 5 or 10, or, you know, for those of us who have still in the UK still got those little red books, You know, we've got a record, but this will be a record that will last forever almost. So it means you can easily go back to things and go, oh, actually, what happened last year or the year before on which set of meds he was on.
Okay. So if things change, then will I be able to go back into the registry and update my information?
You'd absolutely be expected to try and update it, certainly every year, but if you need to update it more regularly, you can do that too. What help can we provide to help people? What can we do?
So obviously for families living in the UK, we have a family support service, and our family support team have been supporting our members to complete their information on that registry. We also have a website that's got lots of information on there and guidance on how to do that. There's a question and answer session as well that is really useful. But you know, we're always at the end of the phone to be able to help guide people with that. And so what I would say is, if you are struggling, please don't stop that. Don't let that stop you from completing the registry. You know, pick up the phone, send us an email, and we'll help you as much as we can.
Please fill in the registry. It is relatively simple. Will take an hour and a half max. You can go back to it and complete it. You get all of your information in one place, including all your meds and what's happened to either you as an adult with Alström syndrome, or if you have a child with Alström syndrome. And eventually it means we will have this very big picture of all of those in the world. That's what we're aiming for, to map globally Alström syndrome, improving our knowledge and ultimately improving treatments and the management of this ultra rare syndrome.
And as a mum living with this condition for the past 19 years, that really does give me hope. It does give me hope in that finally there is an opportunity for everyone to come together and to have all of that information in one place, in the hope that people will learn from that, because I still feel that there is still so much that people need to learn about Alström syndrome before new treatments and things like that are going to come along. So thank you for investing in this, and we really look forward to seeing how it develops.
Hi everyone, thank you for watching this video. I'm Lexi and I am part of the Alström's Global team, and this video is going to be my top tips on managing your diabetes. A few months ago we did a webinar with Alström's Global about managing diabetes, and if you haven't seen that, we will link it in the description below. So my first top tip for managing diabetes is to know your body. Know how your body reacts to different foods, how it reacts to the medications that you're on. Get to know your body really well, and then if you have days where things aren't going quite right, you can maybe understand the triggers a little bit more. Things like stress, hormones, exercise, different foods, they can all affect your blood sugars. So by knowing your body really well and knowing kind of how to counteract these triggers can help you to achieve better blood sugars. So number 2, access the technology that's available to you and utilize it the best way that you can. So I use the Dexcom system, which is a continuous glucose monitor, and we talked about this in depth in the webinar that we did. So this is a wearable device, and it links all of my blood sugars and it sends it directly to my phone, so it's really accessible. There's also other monitors out there, both wearable and just the regular finger stick tests. So whatever machines or equipment that you have access to, utilize those and make those your best friends, and use those to the best of your abilities. My next top tip, and possibly most important one, is don't expect perfection. Blood sugars are, like I said earlier, influenced by so many different things, and nobody is perfect all of the time. We all have those days where everything goes wrong. We've forgotten to take a tablet, we've done more exercise than we meant to, we've maybe miscalculated the carbs, and so blood sugars go absolutely haywire. Don't be too hard on yourself, don't go into a negative spiral, just accept that today wasn't a great day and that we will try to do better next. So my third top tip is to try to get a little bit of exercise every day, and it doesn't have to be hardcore exercise, doesn't have to be for hours and hours on end. Unique, my guide dog here, and I have just come back from a 30-minute walk. We've just been down to our local town, and you know, that will have a really positive impact on my blood sugars. So it can be any kind of exercise, you know, it can be doing housework, it can be dancing, it can be you know, just hanging out and just get your body moving, and just, you know, to try to get that little bit of exercise in each day. So my next and final top tip is to have a healthy diet. You know, try and be as healthy as possible. Get lots of fruit and veg in there. Get your meat for your protein, eggs, and also the carbohydrates as well. But don't necessarily feel like you have to be the food police. But obviously, if you choose to have a chocolate cake instead of maybe an apple, then obviously you have to make that decision and realise that the effect on your blood sugars might be you know, a bit different than it would be if you were to have an apple. So maybe if you chose to have a chocolate cake, then maybe choose to do a little bit more exercise afterwards to try to counterbalance that. So thank you very much for watching this video. We're hoping to do some more videos like this. Please go to the website alstromsyndrome.uk and look at all the really helpful resources that we have on there, and hopefully we'll see you all very soon. Thanks, take care, bye.
I want to thank everyone that was able to attend and join over this hour. I'm going to go ahead and stop the recording now and give people a chance to talk.